Have you ever wondered what are ligaments? And if you have any ligament injury, what does it feel like? How do you diagnose it? And how do you treat it? If this is what you're looking for, this video is for you. Hello, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to yet another video. In this video, we're going to be talking about ligaments. Firstly, understand what are ligaments. Ligaments are ropes that connect two bones. Why do they connect two bones? To give the two bones stability. So they are present around joints. So these are what ligaments are. So they attach to one bone, attach to another bone. They have discrete sites of attachment, a good blood supply, and any structure is akin to break. How do ligaments break? They normally break through injury and rarely aging. What kind of injuries? Injuries can be road traffic accidents, sporting injuries, or just a slip and fall, which can make the ligaments snap either from where they are attached onto the bone, which is called a avulsion injury. Sometimes just the ligament comes out or comes out of the piece of bone. So it's like a clothesline attached to two ends of a wall. It can either break off the wall, take a little bit of wall along with it, or can break in the middle. So that's called a mid-substance tear. Ligaments can also break in varying degrees. So because ligaments are pretty thick, it can be a partial tear or a complete tear. That is, few fibers of the ligament can tear, because ligaments are like broomsticks. Broomsticks are made of multiple sticks together. Few sticks break, you can still use the broomstick. All sticks break, you can't use the broomstick. So there are various grades, grade 1 to grade 3, depending on what ligament it is and what grade it is and how much instability it's producing. You think of whether you would do an operation on it or whether you would treat it conservatively. What are the symptoms? The first symptom is pain. Any injury will cause pain. Second is swelling. So whenever a ligament snaps, there's a lot of bleeding. So that bleeding has nowhere to go. It goes into the joint swells up, be it the knee or the ankle. Third is instability, because remember, its main job is to give stability. So the individual will be able to put weight on that lower limb or that limb properly and feels the knee gives way, or the part gives way, or the joint gives way. These are the basic symptoms of a ligament injury. So what should you do immediately? First thing to do is rest that part. If you have a brace, etc., immobilize it with that. Ice it, take some anti-inflammatories, compress it with a crepe bandage or a brace, and take the patient immediately. Take yourself immediately to a specialist to be evaluated. How do you evaluate it? Various tests. First is clinical examination and history. History is when I talk to you. With what information you give me, like I told you, I can come to a conclusion what kind of an injury do you have. Then I do certain tests when I make you lie down on the bed. Me as a knee specialist, shoulder specialist, I check it. I know, because when I pull the bone away or in a direction which that ligament is supposed to stabilize or prevent the leg from going, it opens up more than normal, whether front to back or either on the inner or outer side. Then you make a clinical judgment as to what ligament it is. You confirm it with certain tests like an ultrasound or an MRI, which tells you how bad the injury is and associated injuries, like whether there's a meniscus or a shock absorber injury or no. Once that's made, you decide to take a final call as to what should be done. Sorry to disturb you, but if you're enjoying this content and you want more and you want to know more and you have people that are suffering from this problem or you're suffering from this problem, please WhatsApp the number below or call the number below. My team will be able to fix an appointment with me either in person or through a video call to help you. Thank you very much. Depending on certain ligaments have an ability to heal. Like most of us have bow legs in India, which are varus knees. So the inner side of the knee is stabilized by the MCL, or the medial collateral ligament, has good blood supply and can many times heal with bracing. However, the outer ligament doesn't. The inner ligament, front ligament called the ACL, doesn't heal properly. So depending on your activity level, what you want to do, your present stability, we take a decision whether to operate or not. If we operate, what do? We do something either called a ligament repair, that means stitch it back, or reconstruction, that is make a new ligament. Reconstruction, you may take a part of the body, but the latest is artificial ligaments, which are very popular. I do a very large number of them also, which are great. Early rehab, nothing's taken from your body, and you're back to activities much faster. These are used to stabilize the knee. After the operation, there's an invariable period of physiotherapy that's required. Whether surgery or no surgery, physiotherapy helps because it strengthens the compensatory mechanisms in the body. Remember, every part has a friend in another part, and that part helps the main part. So strengthening the muscles helps the knee joint, or whatever joint we're talking about. Once that's done, you have a result. So whether conservative or whether surgical, if proper rehab is done, proper surgery is done, patients are usually well in about 6 months to return to sport, etc. I hope you got a lot of information about ligament injuries, how do they present, how do you diagnose them, and what is done for them. If you like my video, please like and subscribe to me on this channel. Please like and subscribe to my Instagram channel, Knee Surgeon in Delhi. And those who like Hindi content, we have a very popular Hindi channel, which is one of silver play button. Please like and subscribe to it. Thank you.